So friends, in this video we studied detailed classification of drugs acting on central nervous system, in which we studied various topics like general anesthetics, CNS depressants, antipsychotics, antidepressants, bipolar disorders, drugs for mania, like that. So firstly we start from general anesthetics, in which two classes: general anesthetics, inhalational general anesthetics and intravenous general anesthetics. In inhalational, there are two types: gas and volatile liquids. In gas, example nitrous oxide, and in volatile liquids, examples ether, halothane, isoflurane, desflurane, and sevoflurane. These are the inhalational general anesthetics. In intravenous general anesthetics, there are two classes: fast acting drugs and slower acting drugs. In fast acting drugs, there are four examples like thiopental sodium, methoxytone sodium, propofol, and etomidate. And in slower acting drugs, there are again three subclasses: benzodiazepines, opioid analgesics, and dissociative anesthetics. Let's see their examples. In benzodiazepines, there are three examples: diazepam, lorazepam, and midazolam. And in opioid analgesics, example fentanyl. In dissociative anesthetics, example ketamine. These are the classification of general anesthetics. Let's see once again. Inhalational, two subclass: gas and volatile liquids. In gas, example nitrous oxide. In volatile liquids, five example: ether, halothane, isoflurane, desflurane, and sevoflurane. In intravenous, two subclass: fast acting drugs and slower acting drugs. In fast acting drugs, there are again four examples: thiopental sodium, methoxytone sodium, propofol, and etomidate. And in slower acting drugs, there are three subclasses: benzodiazepines, diazepam, lorazepam, and midazolam. Opioid analgesics, example fentanyl. Dissociative anesthetics, example ketamine. These are the classification of general anesthetics. So next classification of central nervous system, it's a pre-anesthetic medication drugs. Let's see. There are six subclasses and there are some examples. First class, sedative and anti-anxiety drugs. Example diazepam, lorazepam, and promethazine. Next, opioids. Example morphine and pethidine. Next class, anticholinergic drugs. Example atropine, hyoscine, and glycopyrrolate. Next, neuroleptics. Example chlorpromazine, triflupromazine, and haloperidol. Next, antiemetics: metoclopramide, domperidone, and ondansetron. Next, gastric acid suppression drugs like antacid-like drugs, ranitidine, famotidine, omeprazole, and pantoprazole. Let's see once again classification of pre-anesthetic medication drugs. First class, sedative anti-anxiety drugs. Example diazepam, lorazepam, and promethazine. Next, opiates. Example morphine and pethidine. Next, anticholinergic drugs: atropine, hyoscine, glycopyrrolate. Next, neuroleptics drugs: chlorpromazine, triflupromazine, and haloperidol. Next, gastric acid suppression drugs. Example ranitidine, famotidine, omeprazole, pantoprazole. And last one is antiemetics. Example metoclopramide, domperidone, and ondansetron. Let's see next classification of central nervous system. So our next classification of CNS is sedative and hypnotic drugs. Let's see, there are four classes: benzodiazepines, barbiturate, non-benzodiazepines, and other CNS depressants. Let's see one by one. In benzodiazepines, there are again three subclasses: hypnotic, anti-anxiety drugs, and anticonvulsants. Let's see in hypnotics: diazepam, flurazepam, nitrazepam, alprazolam, temazepam, and triazolam. In anti-anxiety drugs: diazepam, chlordiazepoxide, oxazepam, lorazepam, and alprazolam. Next, in anticonvulsant class: diazepam, lorazepam, clonazepam, and clobazam. All drugs ends with palm, like it's a suffix. Okay, palm or zam. These are the drugs for benzodiazepines. Next class, non-benzodiazepines start with Z. Non-benzodiazepines start with Z like zopiclone, azopiclone, zolpidem, and zaleplon. Next, barbiturates. There are three barbiturates like long-acting, short-acting, and ultra-short-acting. Like barbiturates drugs identified is suffix ends with like tone, like barbitone, phenitone. Like so, long-acting phenobarbital, short acting butobarbital and pentobarbital, ultra short acting thiopentone and methotrexate. Okay, these are the classification of barbiturates class of sedative hypnotic drugs. In long acting phenobarbital, in short acting buto and pentobarbital, and in ultra short acting thiopentone and methotrexate. And other CNS depressant drugs is like chloral hydrate, triclophos, paraldehyde, glutathione, methaquilone, meprobamate, promethazine, chlorpromazine, amitriptyline, and morphine. So, friends, these are the classification of sedative hypnotic drugs from CNS category. Let's see once again non-benzodiazepines sedative hypnotic drugs: zopiclone, zopiclone, zolpidem, and zaleplon. Let move to the next classification is anti-epileptic drugs like epilepsy. First one, barbiturates, example phenobarbital, deoxybarbiturates, primidone, hydantoin, example phenytoin and fosphenytoin, immunostilbene, example carbamazepine and oxcarbamazepine, oxcarbazepine. Next, succinimide, example ethosuximide. Next, aliphatic carboxylic acid, example valproate sodium and duvalproix. And another name of valproate sodium is a valproic acid. Next, benzodiazepines, example clonazepam, diazepam, lorazepam, and clobazam. Next, phenyltrazine, example lamotrigine. Next, cyclic GABA analogs, gabapentin and pregabalin. And newer drugs for anti-epileptic, topiramate, zonisamide, levetiracetam, figabatrin, tiagabine, and lacosamide. So these are the classification of anti-epileptic drugs. Let's see once again. Barbiturates, phenobarbital, deoxybarbiturates, primidone, hydantoin, phenytoin, and fosphenytoin, immunostilbene, carbamazepine, and oxcarbazepine, succinimide, ethosuximide, aliphatic carboxylic acids, valproate sodium, and duvalproix, benzodiazepines, clonazepam, diazepam, lorazepam, and clobazam, phenyltrazine, example lamotrigine, cyclic GABA analogs, gabapentin, and pregabalin, and newer drugs like topiramate, zonisamide, levetiracetam, vigabatrin, tiagabine, and lacosamide. Let's move to the next topic. Our next point is anti-Parkinsonian drugs. So, friends, there are two subclasses: drugs affecting brain dopaminergic system and drugs affecting brain cholinergic system. Okay, in which we see Parkinsonianism means a dopamine level is low, so we treat for increasing dopamine system in brain. So let's see first one, drugs affecting brain dopaminergic system. There are six subclasses: dopamine precursor, peripheral decarboxylase inhibitors, dopaminergic agonists, MAO-B inhibitors, COMT inhibitors, and glutamate agonist means CNMDA receptor like dopamine facilitator. Let's see one by one example. Dopamine precursor, example levodopa. Peripheral decarboxylase inhibitors, example carbidopa and benzerazide. Next, dopaminergic agonist, example bromocriptine, ropinirole, and pramipexole. Next class, MAO-B inhibitors, example selegiline and rasagiline. Next, COMT inhibitors, carboxymethyl transferase inhibitors, example entacapone and tolcapone. Next class, glutamate agonist means NMDA receptor, example amantadine. So these are the some drugs for help for increasing the level of dopamine in brain. Okay. Next, drug affecting brain cholinergic systems means these drugs decrease the level of acetylcholine in brain. First one, central anticholinergics. Example, trihexyphenidyl, procyclidine, and biperidine. Next, antihistaminics. Example, orphanadrine, promethazine. These are the two drugs for antihistaminics, orphanadrine and promethazine. So friends, these are the classification of Parkinsonian drugs. Let's see once again in quick. Drugs affecting brain dopaminergic system. First one, dopamine precursor. Example, levodopa. Dopaminergic agonists. Example, bromocriptine, ropinirole, pramipexole. Next, COMT inhibitors, entacapone and tolcapone. Next, peripheral decarboxylase inhibitors, carbidopa and benzerazide, MAOB inhibitors, selegiline and rasagiline, glutamate NMDA receptor agonist, a dopamine facilitator, example amantadine, and drugs affecting brain cholinergic system, central anticholinergics, example trihexyphenidyl, procyclidine, and biperidine, antihistaminics, orphanadrine, and promethazine. Let's move to the our next topic is antipsychotic drugs, are also called as a neuroleptic drugs. Let's see once again. First class is phenothiazine derivatives, in which like aliphatic side chain, piperidine side chain, and piperazine side chain. Let's see one by one example. In aliphatic side chain, there are two examples: chlorpromazine and triflupromazine. So suffix ends with promazine. Aliphatic side chain, phenothiazines. Next, piperidine side chain, only one example, thioridazine, like dazine. And next, piperazine side chain, example, trifluperazine and flufenazine, like flufenazine, and trifluperazine. So these are the classification of phenothiazines, antipsychotic drugs. Next, butyrophenones, three drugs, haloperidol, trifluperidol, and penfluridol. Okay. Next, thioxanthines, only one example, flufenthioxole. Flufenthioxole, these are the thioxanthin derivatives. Next, other heterocyclic compounds like spimozide and loxapine. Okay, and atypical antipsychotics, there are so many examples on in comes under atypical antipsychotics: clozapine, risperidone, olanzapine, quetiapine, aripiprazole, ziprasidone, amisulpiride, and zotapine. So these are the classification of antipsychotic drugs or neuroleptic drugs. Let's see once again. In phenothiazines, first one, aliphatic side chain. Example, chlorpromazine and triflupromazine. Next, piperidine side chain. Example, thioridazine. Next, piperazine side chain, trifluperazine and flufenazine. Next, butyrophenones. Example, haloperidol, trifluperidol, and penfluridol. Next, thioxanthin. Example, flufenthioxole. Other heterocyclic compounds, phimoside and loxapine. In atypical antipsychotics, clozapine, risperidone, olanzapine, quetiapine, aripiprazole, ziprasidone, amisulpiride, and zotapine. Let's move to the next topic. Our next topic is the drugs for mania and bipolar disorder and some hallucinogens. Let's see examples of drugs for mania and bipolar disorder. First one is a lithium carbonate. Next, some anticonvulsants like sodium valproate, carbamazepine, and lamotrigine. Next, typical antipsychotics like rosa, okay, olanzapine, risperidone, quetiapine, aripiprazole. These are the drugs for mania and bipolar disorder, like lithium carbonate, anticonvulsants, and atypical antipsychotics. Next topic, hallucinogens. Another names for hallucinogens, it's psychotomimetics, psychedelics, and psychodysliptics. Okay, let's see examples of hallucinogens. First class is indole alkylamines, In indole alkylamines, there are five examples like LSD, lysergic acid diethylamide, lysergic acid amide, psilocybin, harmine, and dimethyltryptamine. These are the indole alkylamines, hallucinogens. Next, phenylalkylamines, mescaline, ecstasy like methylene dioxy, methamphetamine. Next, yaba, methamphetamine plus methylhexanamine. Next class, aryl cyclohexylamine. Example, phencyclidine. It's important drugs. Phencyclidine like aryl cyclohexylamine. Next, cannabinoids. Example, tetrahydrocannabinol. So these are the classification of drugs for mania and bipolar disorders. Let's see once again. In mania and bipolar disorder, lithium carbonate, in anticonvulsants, sodium valproate, carbamazepine, and lamotrigine. Typical antipsychotics, olanzapine, risperidone, quetiapine, and aripiprazole. So move to the next topic. Our next topic is antidepressant drugs. Let's see, there are five subclasses like reversible inhibitors, MAO inhibitors, selective serotonin reuptake inhibitors, or typical antidepressants, serotonin and noradrenaline reuptake inhibitors, tricyclic antidepressants. Let's see one by one. In reversible inhibitors of MAO-A, like cremas, reversible inhibitors of MAO-A, there are two examples, moclobemide and chlorgyline. Next class, selective serotonin reuptake inhibitors, SSRI, fluoxetine, fluoxamine, paroxetine, sertraline, citalopram, citalopram, and dapagliflozin. Next class, tricyclic antidepressants. There are two subclasses, noradrenaline plus 5-HT reuptake inhibitors. Example, imipramine, amitriptyline, trimipramine, doxepine, dothifine, and clomipramine. Next, predominantly NA reuptake inhibitors like noradrenaline. Example, desipramine, nortriptyline, amoxapine, and robaxetine. Next class is serotonin and noradrenaline reuptake inhibitors. Serotonin and noradrenaline reuptake inhibitors. Only two examples like venlafaxine and duloxetine. Okay, these are the true drugs like venlafaxine and duloxetine. And in atypical antidepressants, example trazodone, mianserin, mirtazapine, bupropion, tianeptine, aminieptine, and atomoxetine. These are the classification of antidepressant. Our next classification is anti-anxiety drugs. There are short classification, only four subclasses, in which first benzodiazepines, example diazepam, oxazepam, lorazepam, chlorodiazepoxide, and alprazolam. Next, azapirons, buspirone, japirone, and epapirone. Okay, like BGI, buspirone, japirone, and ispapirone. In sedative antihistaminic, hydroxyzine. So, hydroxyzine is a sedative antihistaminic used in anti-anxiety drugs. And in beta adrenergic blockers, only one example, like propranolol. These are the classification of anti-anxiety drugs. Our next topic is opioid analgesics and antagonist. Let's see. There are three subclasses: opioid mu receptor agonists, complex action opioids, and pure opioid antagonist. Okay, antagonists. First, see opioid receptor agonists. There are three subclasses: natural opium alkaloids, example morphine and codeine. These are the natural opium alkaloids. Semi-synthetic opioids, diacetylmorphine, like another name it's a heroin. Next, folcodine and ethylmorphine. Next, synthetic opioids, pethidine like meperidine, methadone, fentanyl, dextromethorphan, and tramadol. These are the synthetic opioids. These are the classification of opioid mu receptor agonist. Once again, let's see. Natural opium alkaloids, morphine and codeine. Semi-synthetic opioids, diacetylmorphine, heroin, pholcodeine, and ethylmorphine. Next, synthetic opioids, example, pethidine, meperidine, methadone, fentanyl, dextropropoxifen, and tramadol. Next class, complex action opioids. There are two subclasses, agonist antagonist like kappa analgesics. Example, nalorphine, pentazocine, and butorphanol. These are the kappa analgesics, nalorphine, pentazocine, and butorphanol. And next is a partial mu agonist and kappa antagonist. So example is a buprenorphine. Okay, buprenorphine is the partial mu agonist and kappa antagonist. And last one is a pure opioid antagonists. Example, naloxone, naltrexone, and nalmefene. These are the antidote for morphine poisoning. Okay, like opioid poisoning. Naloxone, naltrexone, and nalmefene. Let's move to the next topic. Our last topics from central nervous system classification is CNS stimulants and cognition enhancers like cerebroactive drugs. Let's see first CNS stimulants. First one is a convulsions. Example, strychnine, picrotoxin, bicuculline, and pentynyl tetrazole. Okay. Next, analeptics. Example, doxapram. Next, psychostimulants. Example, amphetamines, methylphenidate, atomoxetine, and modafinil. Others are modafinil, pemolene, cocaine, and caffeine. These are the some CNS stimulant drugs. Next class is cognition enhancers or cerebroactive drugs. First one is a cholinergic activators. Example, rivastigmine, donepezil, galantamine, and tacrine. These are the cholinergic activators. Next class, NMDA antagonist. Okay, NMDA antagonist. Example, memantine. Memantine is are the glutamate antagonist. And last class is a miscellaneous drugs. Example, paracetam, pyretinol like pyrithoxine, dihydroergotoxin like codorgocrine. Next, citicoline, pyribedyl, and ginkgo biloba. So, friends, today we complete our pharmacology classification of central drugs acting on central nervous systems, in which we see general anesthetics, antipsychotics, antidepressants, anti-anxiety, sedative, hypnotic drugs like uh, analgesics, opiate drugs, CNS stimulants. So we will meet in a next video with new class of drugs. Thank you.